Hello and welcome to this week's Facebook Live on COVID-19 and the work towards the elimination of communicable diseases. My name is Ashley Baldwin from the Department of Communications at the Pan American Health Organization, and I'm joined here this morning by two experts from PAHO, Dr. Luis Castellanos, who's the Chief of the Neglected Tropical and Vector-Borne Diseases Unit at PAHO. Good morning, Luis.
Good morning, Ashley, and thank you for the invitation. It's always a pleasure having the opportunity to interact with the followers of Facebook Live of PAHO.
It's always a pleasure to have you too. And we're also joined by Dr. Massimo Ghidinelli, who's Chief of the HIV, Hepatitis, Tuberculosis, and Sexually Transmitted Infections Unit of PAHO. Good morning, Massimo.
Good morning to you, Ashley, and a warm welcome to all followers who are with us today.
So as per usual, when we do these Facebook Lives, we're here to answer your questions. So if at any point during the next half an hour, 40 minutes duration of the Facebook Live, you have any questions that have to do with COVID-19 and the impact on the work towards the elimination of communicable diseases, particularly in the Caribbean region or other English-speaking regions of the Americas, please don't hesitate to pop it into the comments section, and we will ensure that we get to it before the end of the session. So during her press briefing on the 11th of August, the director of PAHO, Dr. Carissa Etienne, brought attention to the fact that while the region of the Americas remains under the grip of COVID-19, we're still the epicenter of COVID-19 in the world. The pandemic is also disrupting our ability to control transmission of other infectious diseases, many of which we've been fighting to eliminate for decades, and some of which countries are on the verge of elimination. So what does this mean for countries where infectious diseases such as malaria, dengue, and tuberculosis are already a huge public health issue? How are they coping with managing COVID-19 and also ensuring that these other diseases are kept under control and that the path to elimination of these diseases in some cases is not disrupted too much? I wonder if you could tell us a little bit, Luis and Massimo, about what are some of the main infectious diseases that are impacting our region, and particularly in the Caribbean, where the majority of our English-speaking audience is located.
Who starts, Luis or?
Please go ahead.
Either one.
Can I kick off? Right. So let me mention maybe one of the most relevant to the context of the Caribbean. Let's talk about the HIV epidemic. At the time, the Caribbean has been looked at as the second most severely hit region in the world, second to sub-Saharan Africa in terms of the magnitude of the HIV epidemic. At the same time, we think that the Caribbean has also made an extraordinary progress in responding to the HIV/AIDS epidemic, to the point that the region has been, for example, the first to achieve the certification of the elimination of mother-to-child transmission of HIV and simultaneously of syphilis. And now there are as many as 7 Caribbean countries among the very few worldwide that have achieved such an extraordinary result. As we all know, HIV and AIDS as an epidemic, as a major public health problem, have also been set globally and regionally as candidates to elimination by 2030. We all want to end AIDS by 2030. This is rightly the language that had been used. And the path to elimination is clearly in motion. What we worry now is the impact of this COVID epidemic, which may negatively affect the progress that we have been achieving. And when I talk about progress, I'm not only referring to the extraordinary results of the elimination of mother-to-child transmission, but I am also thinking about the very high level of coverage in the provision of antiretroviral therapy that keeps persons living with HIV in the region alive and in good health. So Obviously, a situation as complicated, as impactful as COVID is putting a major threat to the continuity of all those services, regular visits, regular supplies of drugs, regular monitoring of clinical and laboratory conditions. All those interactions that have made these achievements possible have now gone under threat. So there are also mitigation efforts underway, but we are very concerned. HIV being an example. There are many other examples, but I would like to maybe to leave the floor to Luis to elaborate a little bit more on some other conditions.
Mhm. Well, thank you, Massimo, and thank you, Ashley, again. I think Caribbean countries have always been a leading force when it comes to elimination. I like to use the example of malaria as an instance. All of the Caribbean English-speaking have controlled and eliminated malaria probably 40 years ago, which set a standard for everyone around the world to try to understand how is it that these extremely tropical countries situated in the middle of the ocean managed to have absolute control on a vector-borne disease, being tropical islands and attracting millions of tourism around the world. That's a spectacular public health machinery that they maintain to do this activity. So, and in that sense, we use them as a positive example on how other regions should move. We were trying in the last few years to properly document how they managed to also control and eliminate another disease called schistosomiasis. And may not be as important now to understand, but the meaning of eliminating this disease is that all of the sweetwater bodies that exist in Caribbean islands, rivers and lakes, were clean of a specific parasite that was responsible for the transmission of this disease, which made a healthier environment for everyone to live and for the tourism to visit. And we were almost in the last phase of documentation to properly acknowledge, internationally, the elimination of this disease in the cluster of the entire Caribbean region when COVID hit. And it's for everyone to remember that COVID cannot ignore the fact that these are and continue to be tropical countries. And tropical countries have water, raining, exposure to natural disasters, which very frequently complicate the management of these diseases very often, particularly when you have to deal with vector control, mosquitoes. As long as you have mosquitoes in a geographic location, you will always be exposed to the risk of acquiring mosquito-transmitted diseases. And that's Caribbean countries. So I think we're very closely working with them. We're very closely collaborating with them because they're always the leading force, managing the prevention and control, and even the individual case management of these diseases. But it definitely, I agree with Massimo, is not an easy thing to do considering the negative impact of COVID nowadays.
And you both mentioned, just to follow up a little bit from some of what you said, which was very interesting. Massimo, you mentioned that the Caribbean region is leading the way in the Americas for the mother-to-child transmission of HIV. And I think Luis mentioned, something very similar, but with malaria. So could COVID-19 set this region back when it comes to the elimination of those diseases? I mean, could we sort of go into a situation where we're heading in reverse a little bit? Are there measures that need to be consistently carried out to ensure that, okay, we've achieved elimination, but now we need to maintain elimination? How much is that threatened by COVID-19?
You're absolutely right, Ashley. This is really our major concern. All those achievements that were hardly thought, with heavy work and investment over the many years, all those achievements can be reversed. And, this achievements of elimination or good coverage in the provision of services stays as good as it continues. What we need is continuity. We need continuity in the provision of services. We need continuity in the supply of consumables, in the maintenance of equipment, but we also do need continuity in the visits from patients. And if all these environments and systems are impacted by an external force, which is COVID, that jumped onto all these systems and disrupted all of them, clearly the concern is all there. Luckily, as I mentioned, and if you want, we can open a little discussion on some of the mitigation measures that, in the meantime, it's not that systems have been passively assisting to this disaster. On one hand, we are taking notes and we are trying to document as much as we can without interfering too much with the day-to-day operation, but we are trying to discreetly monitor to describe the extent and the magnitude of this impact in order to learn lessons and also to make forecasts, projections, provisions for as soon as we will be back to normality, we will have to take account of what extent of the damage this whole COVID issue has been about. But at the same time, we are also recommending through the delivery of guidelines, capacity building, we're trying to collect experiences that come from member states, from countries. We're trying to compile those experiences and describe them in a way that can be replicated in virtually all other settings. And so a number of mitigation measures is actually emerging, and it is actually being prepared in terms of guidelines, gold standards. So we're doing the usual work in an emergency mode. So we're learning how to contrast the impact of COVID. We are translating those experiences into hard data with evidence-based guidelines and normative work. And then we are recommending those measures to be implemented at full scale. And some of them really can make a huge difference. Think, for example, in increasing the provision of and the supply of drugs. When a patient comes from a monthly delivery of antiretrovirals, for example, the standard being between 1 and 3 months in ordinary conditions. Under extraordinary situations like the one we are living, we are recommended to consider for patients who are well stabilized, well known by the physicians, to perhaps increase that supply maybe up to 6 months, so that that very patient doesn't have to take the stress of continued or repeated exposure, visits to the clinic. At the same time, we are recommending to make maximum use of telemedicine's options. What can be done remotely, virtually, as we are all doing these days, can also apply to the encounters between providers and patients. In TB, this has been largely used, telemedicine, to including the provision of directly observed therapies, the DOT therapy that has been so successful in contrasting tuberculosis. Tuberculosis is not a major problem in the Caribbean. It is a candidate to elimination, and we do have a number of countries in the Caribbean that belong to what we call the group of low incidence, very low levels of TB, ideal conditions for elimination by 2030. Those are the issues that are worrying all of us, and which we don't want to revert to situations of earlier times with much more burden of disease.
Right. And Luis, I know that just before we begun this Facebook Live, we were talking a little bit about the recent reports of dengue outbreaks in the Caribbean. Now, I didn't even realize that that dengue was happening in the Caribbean. Can you tell us a little bit about why these outbreaks are occurring? You know, is it because of COVID-19, do you think, and what can be done to address them?
Well, I think it's important to mention that as of last week, Ashley, there were official reports of almost 2 million cases of dengue in the Americas as a whole, which is a significant number, with several thousands of severely ill patients admitted in hospitals and several hundreds of patients who have died. That continues to be a threat to every single country. And countries of the Caribbean have a long history of fighting these vector-borne diseases. But definitely COVID, as Massimo stressed right now, is putting a lot of pressure on the health systems. So the provision of medical services and the confidence that the population may have to access those medical services, either because they fear being exposed and infected from others to COVID, or because they just simply cannot access medical services because services are highly concentrated and trying to respond to the COVID emergency. It's uncertain. So yes, there is a couple of Caribbean countries that have very recently, as of this week, reported a significant increase in the total number of dengue cases. And PAHO is collaborating with ministries of health to properly address the situation. We were supporting ourselves very much in these electronic platforms. So consultations in regards to vector control, clinical management, laboratory diagnosis have been over the distance, trying to exchange and update information and knowledge so we on both ends know what's best for each country. We also are in the process of translating into English a very, very recent online course that we are putting up for clinicians, regardless where they're physically located, just to access the virtual campus that PAHO offers for free. So these clinicians working can just simply access the course, do 20 hours of training, and refresh themselves with up-to-date and state-of-the-art knowledge and techniques to properly manage cases. There's a lot of fear in terms of if a patient develops fever, would this fever be because of COVID or because of dengue or any other arboviral disease? Could it be malaria? So we're trying to do a lot of effort to guide clinicians to better understand clinical management and provisional diagnosis of a patient to better determine if it should be considered initially as a COVID or as a dengue. You mentioned, could this COVID be threatening the possibility of elimination? And countries of the Caribbean have always demonstrated for the last 40 years that the threat of reintroduction or reestablishment of a disease in their territories is a living threat. So we have history in early 2000 that a couple of countries had this occurrence of malaria cases, which was considered a surprise, because after years and years and not seeing malaria occurring in certain countries, it really calls everyone's attention to find out why this disease reappeared in a specific geographic location. It just reminds us all, the country in particular, the rest of Caribbean countries, of the importance of maintaining their vector control and clinical management activities alive, because as long as they receive tourism, the risk of importing cases is always there.
Right. So just to recap, we're here on a Facebook Live talking about COVID-19 and the work towards the elimination of communicable diseases. I'm joined here by Dr. Luis Castellanos, who's the chief of the Neglected Tropical and Vector-Borne Diseases Unit at the Pan American Health Organization, and Dr. Massimo Ghidinelli, who is the chief of the HIV, hepatitis, tuberculosis, and sexually transmitted infections unit at PAHO. If you have any questions at all, you can pop them in the comments section and we'll get to them towards the end of this Facebook Live. So we've spoken a little bit about some of the infectious diseases that are impacting the Caribbean in particular. And I just wondered what this means, you know, if elimination is impacted, what does this concretely mean for members of the public? I know that Luis, you mentioned about the parasite in sweet water sources in the Caribbean, but why is it so important that countries organize their health services so that they can so they can address the COVID-19 pandemic, but at the same time, not set themselves back on the road towards elimination?
We've been having a very close contact with health authorities in all of these countries in close consultation to determine when is the right time to retake the ability to start normalizing activities or programs that have operated regularly in public health within these countries without forgetting the need of keeping a specialized team and leadership of professionals to continue taking care of the response to the pandemic. What is clear for many public health authorities and government is that it's very unlikely that we can continue only focusing on responding to COVID-19 and forgetting the threat and the risk that these many other diseases represent for the public health and the well-being of the populations living in at-risk areas. So I think we're very, very quickly agreeing in that one of the first steps we need to guarantee is to secure the safety conditions of work for public health workers. We understand that during the peak of the epidemic and the emergency response, if there were not enough personal protective equipment, devices for everyone, it should have been prioritized for those responding to COVID. But now that time has elapsed, we need to realize that every single public health worker need to have access to personal protective equipment so they can retake and go out to the community and contact in a safely environment to provide the medical services the population is used to. If I am a patient with fever and I suspect that I have malaria or that I have dengue, I should feel comfortable going to a specific primary healthcare setting and having interactions with public health workers that can help me, but knowing that both the public health environment, the public health worker, and the population, the patients visiting these primary healthcare centers are interacting in an environment that guarantees the safety of both. So PAHO and the countries have been working for the last few weeks in guaranteeing the procurement and distribution of many of these preventive personal protective equipments, not to be distributed among COVID responders, but to be distributed among public health workers dedicated to other diseases that are also priority for these specific countries.
Thank you. And we've just had I don't know if you have the latest data to hand, Luis, but Gold Knight, I wonder if you could confirm that there are more people infected with dengue than with COVID-19 in the Americas.
Well,
you know that at all?
No, that wouldn't be accurate. I can tell you that. I mean, just look at the numbers by country. We all know that just Brazil has over 2 million, probably 3 million cases of COVID as we speak, just that single country. Mexico has 500,000 cases of COVID documented. Peru, Chile, Colombia, Argentina, they're almost 250,000. So the total number of confirmed COVID cases rise up, I think, to close to 10 million cases, not to mention the situation in the United States. So it's plenty more diagnosed and confirmed COVID cases than it is for dengue isolated. But on the other hand, I understand that the reflection of the person accompanying this conversation that if we already have 2 million dengue cases, it's something that is alarming for everyone to understand that no, dengue has not disappeared. Dengue is moving around. It's just that we are not seeing the reflection in the media, the call for attention to this particular disease, because COVID has completely captured the attention of everyone. But if there's something that I could tell everyone is, please remember that as we are all forced to stay home and do telework and remain in our home environment for longer periods of time, if there is one single action that we all can do to contribute to protect our family and our neighborhood, is to make sure that mosquito breeding sites are under control. No mosquito breeding sites inside the household, and then the surrounding environment of the house, the green areas, is almost a safety guarantee of the minimized risk of contraction of these diseases, because if we don't have contact with mosquitoes, we're not exposed to diseases.
And when we talk about the breeding sites for mosquitoes, we mean make sure that you don't have plant pots that are empty, that are filling up with water, things like that.
I mean, countries of the Caribbean have been very successful. They're very knowledgeable in terms of what a mosquito breeding site is. It's either a container where people collects water for human consumption, or the plant pots inside the house, the proper arrangement and covering of solid disposals and trash. All of this, everyone in the community already have the wisdom to clearly understand, notice, and detect what is it that we know is considered a mosquito breeding site that should not be there. Without that, they're doing most of the work instead of waiting and see if the Ministry of Health reactivates the sending of mobile brigades to do the mosquito breeding control activities. That's something we can do in our own house.
Right. Massimo, so Luis has told us a lot about what members of the public can do to prevent vector-borne diseases in the Caribbean. But one thing that you were mentioning that's particularly important in that region is HIV. And you mentioned that it's important that people ensure that they have maybe longer term prescriptions of antiretrovirals. Can you talk us a little bit about what members of the public can do as far as ensuring that they're accessing doctor's appointments if they need to access a doctor's appointment, that they have longer term supplies of medication, and what would be the impact of that not taking place?
Well, this is an absolute recommendation that, of course, it is even more urgent during these times of COVID. The well-being of an individual who has contracted an HIV infection earlier on in his or her life, his or her well-being depends very much on the continuity in her or his intake of medication. At the same time, we know that a person without proper medication who is no longer undetectable, as we used to say, viral suppression leads to inability to detect the virus in the blood. That condition of undetectability is a guarantee towards good health and well-being of the person. It is also a guarantee of a much, much lower level of infectivity. And so that person cannot easily transmit the virus and the infection to another person. But it is also protection vis-a-vis the COVID, because if a person is in good health and the immune system is more competent and more efficient, obviously that represents by itself a good guarantee that COVID may find it harder to get through that individual and generate damage to his or her health. I think, coming back to your question, Ashley, I think besides measures that I have already mentioned, like longer intervals between visits, bigger supplies of medicines to make it possible, there are also other measures that seem to be quite attractive. We had a successful series of webinars in the last few days to talk and promote about self-testing. There's an availability on the market, and many health centers are distributing these tests also to the public or via civil society groups that operate within communities. And they promote and distribute the self-test. So whereby if a person feels like he or she is in need to check his or her HIV status, no longer it is indispensable to go to the nearest clinic and to go through the usual system to get access to such a test. But the possibility exists to self-administer an HIV test, which is not a diagnosis by itself, but it's a first screening to see whether there is any reactivity and eventually take further action as appropriate. This is an interesting measure, and I'm highlighting this opportunity of taking a self-test because there has been really a good and a very high level of interest from the part of the public besides vis-a-vis this new technology, which is coming really and probably being accelerated these times of COVID into the day-to-day practice. It's another great contributor to the to release a little bit the dependence about visiting health centers. So this, together with other measures, I already mentioned the telemedicine, the also the important role that communities and activists continue to play in assisting each other, in helping in moving antiretrovirals wherever persons are no longer able to go and visit the clinic. So they are palliating a little bit what usually and more typically family members do. That kind of community support is also extremely important during this time of COVID pressure.
And if I want to find out my HIV status during the COVID-19 pandemic, how easy is it for me to access one of these self-tests? You know, where do I need to go? Is this something that a country health system will make available, or is there organizations that I can contact?
I would think of three options depending on where you are. Obviously, not all of them being necessarily present at the same time in a given country, but certainly at least one of those three options should hopefully be available. One is to go to a pharmacy and purchase the test. It is still relatively costly, but not prohibitively expensive. Follow the instructions that are coming with the kit. It's a very simple test. Most of the time is a saliva, it's an oral test, or it can be a finger prick with a minimum involvement of blood. And it's usually a cassette, which will allow self-reading and conclusions. Second option is to go to a clinic. In many countries, distribution of self-tests has been initiated by the ministries of health. And to that extent, to that purpose, the strategic fund of the Pan American Health Organization is supporting in the procurement of certified good quality such test kits. And then the third option is to resort to a community clinic or a community NGO-based center or network, because many civil society organizations are getting involved into the distribution of such self-tests. Let me remind that in any case, after self-administration and self-performance of an HIV self-test, in case of reactivity, the need is there to continue the path towards confirmation of the test, and so re-establish the contact with the health system for a more formal assessment of the HIV situation. It's a good screening test, at least to rule out, useful to rule out the consequences of a potential exposure to HIV transmission.
Right. During the last directing council at the Pan American Health Organization, countries of the Americas signed up to something called the Elimination Initiative, which is really just a regional commitment to eliminate certain infectious diseases, but I think that there's also sort of environmental determinants of health on that list as well. Could you tell me, maybe Luis, you want to start a little bit more about the Elimination Initiative and why it's so important that we work together as a region towards elimination of these diseases?
Sure. Thank you, Ashley. The Elimination Initiative, it's a plan to be implemented in countries of the Americas, and is based on the long history and documented success of many of the countries of this region in controlling and eliminating diseases. From many, many years ago, back in the early 70s, when malaria started to be eliminated in many countries of Latin America, to the successful campaigns that led to the elimination of vaccine preventable diseases in our region, very lately rubella and measles. We understood that the public health systems operating in our region were strong enough to pursue, even more so, to try to not only control but to completely shrink the threat of these diseases to a minimum standard, which is elimination. Elimination meaning the disease is no longer a reason for concern, as long as the government maintain a baseline structure that do surveillance and preventive activities for a longer period of time, because we know the disease continues to exist in other regions around the world, which is significant for countries of the Caribbean, as I said before, understanding the relevance of tourism in this particular region. If you know you have cases of diseases around the world, and every single tourist putting a foot on a Caribbean country represents the potential of reintroduction and reestablishment of these diseases, even more if the disease is transmitted by a vector. I can carry the disease and arrive by myself, not feeling well, as simple as that, thinking I may have a flu. And then I get bitten by a mosquito, and this mosquito acquires the microorganism and starts spreading it through the local population in a Caribbean country. And that's the real threat, the risk of being reintroduced. So as long as the country remains vigilant in terms of detecting suspects of this disease, and as long as the country remains to be properly structured to respond if a case is detected, they're safe. And as I said before, countries of the Caribbean have been doing this to prevent reintroduction of malaria for 40 years in a very successful manner.
And Massimo, can you tell us a little bit about some of the diseases that are on that list for the Elimination Initiative? You know, we mentioned mother-to-child transmission of HIV. I think tuberculosis is on the list.
We do have hepatitis, which is certainly another disease for which the Caribbean has been significantly ahead of the curve in introducing particularly the vaccination for hepatitis B, making it become the standard for immunization of newborn. That's a good example because vaccination and immunization activities are also severely impacted by COVID. So as long as vaccination continues to be effective and maintaining the very high rates of coverage, we have little to worry about a number of conditions that were either eliminated already or are on the verge of elimination, like in the case of hepatitis B. But you know, the reason why last year, since you mentioned the Directing Council, the meeting of health ministers, once a year gathering in Washington, D.C. to discuss the most relevant topics of the public health agenda for the region. So in that meeting last year, we simply presented the idea to escalate the response to communicable diseases, not all of them, but a significant proportion, talking about more than 30 among diseases or conditions related to specific diseases. So we presented that framework, gathering all those candidates to elimination, not all of them simultaneously affecting each individual country, but we presented that framework with the intention to say, okay, in any given country, there are certainly some candidates that could be of interest. And the response, believe me, Ashley, it was really enthusiastic. So they believed, ministers of health felt the opportunity to really escalate the response to a new stage, setting the 2030 as the horizon for the elimination of a good number of those diseases. Based on what Luis was mentioning, a long record of success, the Caribbean in particular has been a living workshop in the world to experiment, to try out new approaches, implement new strategies, and it has been extremely successful in a number of occasions. All that is in the spirits of ministers of health, to the point that they enthusiastically responded to our call and they endorsed the idea, which was in basically the key message in our policy document was, take note of all these opportunities. We do have the technology, we have the knowledge, and we can implement all those in virtually all countries. Take them back, take the message back to your country and try to open up a discussion to be inclusive so that your next health plan and health strategy will take into account what matters in your country in identifying what diseases can be prioritized, what measures can be strengthened, and then move ahead onto the elimination path. And as I said, out of the 30 plus candidates, there certainly are several. We mentioned HIV, we mentioned the mother-to-child transmission of HIV, of syphilis, we mentioned the hepatitis B through the vaccination campaigns. Similarly, we can eliminate cervical cancer, which is a condition affecting a significant number of women throughout the region, including in the Caribbean, which can be easily prevented and eventually eliminated as a public health problem. We can eliminate tuberculosis, and I already mentioned how in the Caribbean, TB is already at a relatively low level of morbidity and mortality, with the peculiarity that in some groups of countries, this level is even further low, making those countries natural candidates for TB elimination by 2030. And the list can continue. So as long as we will be able to maintain a little bit of continuity in the provision of services, I do believe we will be able to limit the damage that the COVID impact is generating on health systems. The overarching risk is really to push the region back several years in terms of achievements. And then at a point in time, we will have to compensate and basically recover from that delay and that damage that the COVID is imposing on all of us.
Right. I just have one final question for you both then, really. So countries have made, including countries of the Caribbean, have made this commitment towards the elimination of 30 plus diseases by 2030. And we know, Luis, you mentioned that there's, countries were very close to eliminating this waterborne parasite in the Caribbean. And, we know that Guyana was sort of in the latter part of a mass drug administration to eliminate lymphatic filariasis. What can we do now to ensure that health systems, what would be your recommendations to ensure that health systems continue to address these infectious diseases within the context of COVID-19, and that these sort of achievements towards elimination, almost achieving elimination in some cases, aren't getting set back by years?
Yeah, the concern is there, Ashley, and health authorities in various countries are very, very aware and concerned of the potential negative impact of not pursuing this last mile to complete the task that may have taken years to achieve or just to reach to the level where they are. Big impairment now is the concern of launching activities that demand community gatherings for obvious reasons. We don't want to be responsible of collecting people in a single place and expose them all to COVID-19. So one of the strategies that we determined is a close look from the local environment and up. So public health authorities at very local levels, city levels, municipality levels, from the very local environments where disease occur, to keep us informed and do a good tracking on how these both COVID and other diseases are behaving, to be strategically in determine when would be the right time to start retaking collective interventions at community level, minimizing the risk of exposing population to COVID-19. So a couple of Caribbean countries that have halt the need of doing these called public health surveys to see who is sick and who is not, or the public health activities to do distribution of medications to everyone in a specific geographic area, are temporarily suspended now. But we're very actively involved in consultation with government at central level and government at local level to determine how soon we could go back and keep this safe and balance of doing the intervention to complete the last mile and generate the results we need to confirm elimination of these diseases without ignoring the existing risk of the current pandemic.
Thank you.
And I would say, maybe in very general terms, that in my view, the way out of this complex situation relies on two main key blocks of factors. On one hand, I think there's a need to ensure that all measures that we know are working for the containment of COVID are in place. I think Luis already largely mentioned the need to guarantee access and distribution of protective devices, personal protective devices. I would add some of the other measures that are known to be effective: the social distancing, washing their hands, and ventilation. If all these measures are properly in place, we can significantly reduce the risk of exposure to COVID transmission. And then the other block of measures are those mitigation interventions that I already mentioned earlier on. So if you can dilute and reduce the number of encounters needed to maintain continuity of services, if you can provide larger supplies of drugs, if you can make better and more intense use of telemedicine, if you can engage family members or acquaintances or members of the community for some of the functions that individual patients may not be able or may not be comfortable to carry out, it's the conjunction of all these measures that can help us collectively to come across this difficult time, and then learn experiences probably to reshape and redesign, reconfigure health services once we will be out of this pandemic. Because certainly the health systems that we have known so far will no longer be the same after we will get out of the pandemic of COVID. What we need is to have even more resilient health systems that are capable to take into account and translate quickly into practice all these measures that together can make a big difference.
Well, thank you so much for taking the time to come and speak to us today about COVID-19 and the work towards the elimination of communicable diseases. Over the next few days and a few weeks, we'll work to put the links that we mentioned. I know that, Luis, you were talking about a course that's going to be available in English, so we'll make sure that when that's ready, there's a link section in the comments under this video. But thank you so much for joining, and continue to follow us. We'll be back next week to talk about suicide prevention in the context of COVID-19. Thank you, Luis. Thank you, Massimo. And thank you all. Have a great rest of the day. Bye-bye.
Thank you, Ashley. Thank you very much, our viewers. Bye-bye.
Bye. Thanks.